everyone, so this is Dr. Sarosh from the platform of UKMLA with DSS, and let's move on to the next lecture of the success course of the UKMLA 2 exam. Okay, in the last lecture we discussed about the management and what are the protocols that needs to be followed in the management. In today's lecture, what we are going to do is that we're just going to cover a few basic pointers that are important for the exam purpose. And so this lecture that I've prepared is basically, from the FAQs that I usually receive, and from the queries that keeps on coming to me. Okay, so that includes the questions that I usually receive. That okay, Dr. Sarosh, what are the referrals in the UK? Then very important aspect that what if I'm unable to reach a particular diagnosis, and what if there are two differences in my mind, then how do I deal with that situation? Then what are the conditions in which we have to call an ambulance, arrange and transport? What are the notifiable diseases in the UK? And when to involve the DVLA, and when to give driving advices. Okay, so one by one, I'm going to discuss all of these things, and it's not going to be a very long lecture because most of it I've already discussed in the previous lectures. All right. So we discussed about the referrals in the UK, and we talked about that. Okay, what are the type of referrals? Okay, and we discussed that there is an immediate referral that is done for the red flags. Okay, and that is done for the emergencies. So I'll just shed some more light on what can be the possible emergencies. Okay, uh, the emergencies can be the life-threatening conditions such as MI, stroke, subarachnoid hemorrhage, ectopic pregnancy, or DKA, in which your life is at risk. Okay, so all of these cases needs to be immediately referred. Okay, other than that, the emergency can be the one in which there is a risk to an organ. Okay, an organ may be leading to a failure. Okay, like for example, all the vision problems, all the eye problems, in which there is loss of vision, there is a very strong risk of the vision getting compromised and the vision getting destroyed for the rest of their life. Okay, so a particular organ is at risk. Okay, so you need to keep that in mind as well when you're thinking about the referral. So all eye problems, all vision problems, okay, make sure that they are immediately referred to the eye emergency. Okay, other than that, there are a few red flags that you need to be identified in the psychiatric patients, like for example, hallucinations. Okay, low mood, risk of self harm. Okay, like these are the three red flags that are very commonly seen in the psychiatric patients. Okay, somebody having hallucination, somebody having a low mood, and somebody having a risk of self harm. Okay, if you don't admit these patients, if they end up killing themselves, or if they end up harming someone else, then a lot of issues may come up, and you may have to deal with a lot of issues as a doctor. Okay, and a lot of questions would be raised on your safety as a doctor. Okay, so identify these red flags in the psychiatry and make sure that you admit these patients and identify these red flags. Okay, apart from this, some abuse victims, okay, may you may want to offer admission to them, because not because they are having any psychiatric red flags, or not because if they're having any medically life threatening condition, but because of the abuse their life may be at risk. Okay, like for example, domestic abuse patient, a woman getting abused by her partner. You cannot just send that patient home, because you know that inside the home it's not safe for her. The partner may abuse this patient again. Okay, and it may lead to loss of her life as well. Okay, so these patients need to be identified. Okay, and admission needs to be offered for their safety. And this is why I say that lab 2 requires you to be a very very safe doctor. Okay, you need to give this impression that you are a safe doctor. Okay, and you cannot do anything that is unsafe, okay, when it comes to the medical practice. All right, so never miss out on the things that are important. Never miss out on the cases which requires immediate referral or urgent admissions. Okay, The next two pathways you already know, urgent 2 week wait referral pathway we discussed that it's for the suspected cancers, and the routine referral pathway are for diseases which are not urgent, like for example somebody presenting with body pain, being diagnosed as polymyalgia rheumatica. You can easily do a routine referral of this patient to a rheumatology. Okay, there is no urgency for it. Okay, so those patients would undergo the routine referral. All right. So yeah, you need to be aware of these pathways. Okay. Then moving on to a very very important thing. Okay, and this is a commonly asked question that many students do uh, bring up to me, that Dr. Sarosh, what if we are unable to reach to a diagnosis? Okay, so first of all, uh, it is like very very essential that you reach to a particular diagnosis. Okay, you cannot just get away by playing the dual diagnosis thing everywhere. Okay, uh, you need to make sure that your history and your data gathering is so accurate that the diagnosis is there in your head. Okay, but let's suppose that if the data gathering is not accurate, or maybe if the GMC examiners are like trying to confuse you a lot, then you should come to a point where you are dealing with not multiple, but at least two different differentials that should be in your head, that okay, this can be either this or this. Okay, you should at least reach to this level. Okay, and then there is a way to do the damage control. Okay, so I'm saying this because this is not something that should be a regular practice. If you're not able to come to the diagnosis, damage has already been done because your data gathering was not accurate, you were not able to ask the right questions. Okay, but the dual diagnosis thing that I'm just going to teach you right now is just for the damage control, that okay, instead of getting a zero in the management, let's just try to get at least 1 or 2 mark. Okay, just to save myself, just to give myself some chance. Okay, so let's suppose there's a patient with headache, and you are really confused whether the patient is having migraine or it's a subarachnoid hemorrhage. And now these two are like two completely different diagnoses. One is a non-emergent or elective case. Okay, other one is a emergency and a life-threatening case. Okay, so there's a very smart way to go about it. Okay, and that is that number one, you're going to begin that. Okay, thank you for answering my question, Mr. Adam. And from the chat that we have had, and from my examination finding, I'm a bit confused regarding your condition. I'm a bit confused regarding your diagnosis. Okay, so you have to be very very honest. Okay, honestly tell them that okay, you do not have a clear cut diagnosis in your head. Okay, don't just end up giving a wrong diagnosis just because you have to give a diagnosis, and don't just take a chance of giving the wrong diagnosis. Okay, uh, if you're confused between two, okay, and if you're not inclined towards one particular diagnosis, then go for the dual diagnosis thing, because you'll be safe uh, if you do the dual diagnosis thing instead of giving a completely wrong diagnosis. Just imagine if the patient has subarachnoid hemorrhage and you're thinking that okay, it may be migraine, and then you end up saying migraine and you send the patient home. You're sending a patient of subarachnoid hemorrhage to the home, and the patient may just end up dying because of your wrong diagnosis. Okay, so always better to go for the dual diagnosis if you're not sure. Okay, so after being honest, you're going to say that I'm a bit confused regarding your diagnosis. Okay, so your headache that you're experiencing may be due to the condition called migraine, which is triggered by lack of sleep and dehydration, like in your case. Okay, and it is a pretty manageable condition. However, I'm a bit confused that it can be something sinister, or it can be something serious. That is because of a bleed of a major blood vessel in your brain, which can lead to a surgical emergency, a potentially fatal condition, which we call as subarachnoid hemorrhage. Okay, so now I am confused. I'm honest about it that I'm confused between these two things, and then the patient is going to ask, okay, doctor, then what is it, and what are you going to do for me? So then you would have to do a dual management. Okay, that okay, if it's just a migraine, okay, then what we're going to do is that we're going to just run some investigations and refer you to a neurologist, and meanwhile we're just going to give you some medications for your pain relief, which includes paracetamol, NSAIDs, and a specialized medication called sumatriptan. Okay, and we're going to discharge you on some advices like making sure that you drink a lots and lots of water and make sure that you sleep all right. Okay, so in just 1 minute, I just said all the management pointers. I talked about the investigation, I talked about the referral, I talked about the medical management, I talked about the advices, IRMA. Okay, I covered most of the management part of migraine. Now I have to do the same for the subarachnoid hemorrhage. But in case if it's something as sinister as a subarachnoid hemorrhage, then I'm sorry, I would have to admit you in our care. Okay, and after admitting you, we would have to get a CT scan done and get the neurosurgeons on board, and we may give you a medication to stop the bleed in your brain. But if it is much more severe, then the neurosurgeons might want to take you for a surgery, for the surgical clipping, or to do a surgical intervention to reduce the bleeding that is occurring in your brain. Okay, so if it's an emergency case as well, I talked about the admission, I talked about the investigation, I talked about the specialty that would be taking care of me, and then I talked about the medical management as well. Okay, so I did the RI and M part. Okay, so the major part of the management I just did very quickly in like 30-40 seconds. Okay, and then what you're going to do is that now, since you are confused, now you just talked about it, you're going to say that what I'm going to do for you is that I'm going to call my seniors, I'm going to involve my seniors. My seniors are going to come and have a chat with you, and they would be in a better position to come to one particular diagnosis. Okay, so you have to involve your seniors because you were not able to do it properly. Okay, you were not able to consult properly. You were not confident about your diagnosis. Then you have to discuss this case with your seniors as well. Okay, so you have to say this, that I'm going to involve my seniors and they're going to also have a chat with you. Okay, and if you're lucky enough to get some time at the end of this, okay, then you may ask that, okay, by any chance, Mr. Adam, do you have any concerns regarding it? Okay, and if you're lucky enough, you may be able to, also address at least one concern. So you see, in the 2 minutes, in the 2 minutes 30 seconds, or in 3 minutes, even if you are confused, even if you have two different differentials in your head, there is a way to do the damage control. Okay, by and this way you'll be able to explain the diagnosis as well. You'll be able to talk about the management as well very quickly, and then if you're lucky enough, you may be able to address the concern as well. Okay, so this is a thing that, again, I'll say this is something that I am teaching for the purpose of damage control. Okay, do not make it a habit. Okay, make sure that you are always able to come to the right diagnosis, and your data gathering is so accurate that it is helping you lead to a diagnosis. All right. Now move on to the next section, that is what if an emergency case comes to you in the GP surgery. Okay, uh, there are a few cases in which you would have to send the patient to the emergency. In all emergency cases, you would immediately have to send the patient to the A&E, and it really depends that, okay, how the patient is going to go. Okay, a lot of cases are there in which a patient would be, accompanied by a relative or a friend. Okay, and they would be ideally referred to the E&E, but you would not let them go on their own or with their relatives as well, or with their family members as well, in a private car. Why? Because they may be presenting to you with a potentially life-threatening condition or a potentially serious condition. Okay, and in condition like these, you would have to, arrange an ambulance. Okay, instead of letting them go by themselves, or letting them go with a relative, or on a public transport or something. You cannot rely on that. You have to involve, and you have to order an ambulance. Okay, the patient of myocardial infarction, patient of stroke, potentially life-threatening conditions, patient can die. Okay, any patient that is having bleeding from anywhere, severe bleeding. Okay, the patient would become hemodynamically unstable, the patient can go into a hypovolemic shock. Okay, so you don't want that to happen. Okay, then the ectopic pregnancy, it can rupture, it can lead to sepsis, it can lead to eventually death as well. Okay, then diarrhea and vomiting, severe diarrhea and severe vomiting can also lead to hypovolemia, and it can lead to deranged electrolyte, resulting in arrhythmias. So even if this can be, potentially fatal. So if somebody is having way more episodes of diarrhea and vomiting than normal, more than 6 to 8 episodes, call an ambulance. It's always safe to call an ambulance. Okay. Somebody who is having active seizures, who had an epileptic episode recently, known case of epilepsy, you're not going to send them in the car because they have a risk of aspiration, and again, epilepsy can also be a potentially fatal condition. Okay. So it's like really, really important because all of these cases, would need trained paramedical staff and those, infrastructure that is needed to manage medical emergencies. Okay, so call an ambulance in this case. Other than this, there would be a few cases in which, you don't have to call an ambulance; you just have to arrange the transport. So in these cases, there would be a medical emergency. Yes, you would have to make an immediate referral to the emergency. Yes, but the patient would either be on their own, okay, or maybe the patient will not be accompanied by someone. The patient may have just come to you on his own car, and it's not safe for them to drive a car to the AN. Okay, in those cases, like for example, a schizophrenia case. Okay, a schizophrenia case is not medically life threatening. Okay, yes, it's a threatening case. The patient has a risk of suicide. Okay, the patient may have hallucinations. Okay, but it doesn't need a paramedic staff to take care of. It doesn't need a paramedic staff or monitor or oxygen support to deal with such kind of medical emergencies. Okay, so schizophrenia patient, eye patients. Okay, yes, there is a threat to the organ, threat to the loss of vision, threat to the loss of eye, but again, you don't need a paramedic staff to manage that particular kind of emergency. Okay, patient with falls. Okay, if the fall is due to the ENT reasons, if it's due to the Meniere's disease or BPPV, okay, it's an emergency situation. Okay, needs urgent attention, but it is not something that is potentially life threatening. Okay, so you wouldn't need an ambulance in this case. And TIA. Okay, so if somebody has had a minor stroke and if the patient is not having any focal neurological deficits at that particular moment, then you may just arrange a transport for them. Okay, so why not an ambulance? Because NHS is a government service. Okay, and ambulance is something that does take some cost. Okay, so as a doctor, you should be aware that how you are using the NHS resources, how wisely you are using the NHS resources. Okay, so it's important that this type of patient do not remain unattended. Okay, but you need to identify that, okay, this is the patient that I would want to call an ambulance for, or this is the patient that I would want to arrange the transport for. Okay, just a minor difference, but it does have a very, very significant impact on your consultation. All right. Then the next section is basically the notifiable diseases in the UK. Okay, there are a few diseases in which you would have to involve the public health authorities. Okay, you need to keep that in mind. Like for example, meningitis, cholera, COVID, diphtheria. All of these are like infectious diseases. Okay, malaria, measles, mumps, rabies, tetanus, pertussis, tuberculosis, and MERS. Okay, all of these diseases are the infectious diseases, and most of the infectious diseases they do require public health authorities attention, and this is what we call as the notifiable disease in the UK. So if you encounter any cases of these particular topics, then make sure that you are mentioning and you are verbalizing the involvement of public health authorities, and you are notifying the public health authorities and referring the patient to the public health authorities as well. Okay, and there is a case in Plateau of food poisoning. Okay, in which a patient goes to the restaurant that is owned by one of his friends, and then he develops a food poisoning, diarrhea, fever. Okay, and then when he tells you that, okay, I just had a eat out at my friend's restaurant, and when he says that, you're supposed to involve the public health authorities. Okay, you're supposed to involve the notifiable diseases services. Okay, and then the patient would have been concerned that, okay, the public health authorities are going to shut down my friend's restaurant. I don't want that to happen and all. And then you would have to do some convincing and counseling that, okay, no, that is important. They're just going to go and assess whether the food quality is all right, and this is important for the safety of other people eating at that particular restaurant, and blah blah blah. Okay, so it's important. The food poisoning cases, needs to be referred to the public health authorities as well. Okay, so make sure you're doing that, because if you're not doing that, you're going to be penalized on your management. Now the last section is when to involve DVLA and when to give driving advices. So some of these cases we have already discussed, like stroke, epilepsy, TIA. We know all of these cases are can be potentially life threatening. So they do require driving advices, and they do require driving assistance, and the patient needs to inform the DVLA as well when it comes to these cases. Okay. Other than that, all eye condition, we discussed this thing that eye patient cannot drive. Okay, so all eye condition needs the driving advices and the DVLA notification. All cases of vertigo, okay, BPPV, Meniere's disease, postural hypertension, all of these things, okay, do require DVLA involvement. Other than this, the patients of diabetes and DKA, diabetic patient can go into hypoglycemia. DKA patient can become comatose. Okay, so all of these cases do require DVLA involvement. Obstructive sleep apnea. Why? Because obstructive sleep apnea patients have a habit of daytime sleepiness. They end up, just sleeping while doing their daily task, like while working, and they can end up going to sleep while driving as well. So it can be potentially fatal. Atrial fibrillation patient can also, develop stroke, can develop, drop in GCS, and can result in a car crash as well. Okay, so patient of atrial fibrillation also needs, driving advices and DVL involvement. Other than that, there are two more diseases that you should be aware of. MI, any patient had the recent MI, getting discharged, inform DVLA, give him driving advices. And the patient of Parkinson's disease, okay, because Parkinson's people, they have bradykinesia, they have reduced reflexes, okay, so it would be difficult for them to act in during an emergency situation, okay, so they may need driving advices, and they definitely would need DVLA involvement as well. So these are the cases that you should keep in your mind, and you should be aware of them. Okay, and whenever you see them in your exam, and whenever you encounter them, make sure that you give the driving advices. Make sure you ask about that whether or not do you drive or not. Okay, in your data gathering, so that you are able to use that piece of information for your management. Okay, so yeah, these were the common FAQs that I usually got, and I thought that okay, it should be cleared earlier on as a part of the basics, so that later on in the consultation and later on in the course, a lot of things are like very clear in your head, and you're not really confused what to do if you encounter any of the situation like these. Okay, so that's it from my side. And if you got any queries and if you got any questions, drop them down in the comment or reach out to us on our socials. We are going to address all your concerns in the best way we can. And if you want to sign up for our personalized mock, then scan the QR code, go to our website, fill in a Google form, and then my team is going to schedule a one-on-one mock for you guys if the dates are available. Okay. So that's it from my side. See you in the next lecture.